Indication and usage. CALQUENCE is indicated for the treatment of adult patients with chronic lymphocytic leukemia, CLL, or small lymphocytic lymphoma, SLL. Select safety information. Serious adverse events, including fatal events, have occurred with CALQUENCE, including serious and opportunistic infections, hemorrhage, cytopenias, second primary malignancies, cardiac arrhythmias, and hepatotoxicity, including drug-induced liver injury. The most common adverse reactions, greater than or equal to 30%, are upper respiratory tract infection, diarrhea, headache, and musculoskeletal pain. The most common grade 3 or 4 laboratory abnormalities, greater than or equal to 10%, are absolute neutrophil count decreased, uric acid increased, absolute lymphocyte count decreased, and platelets decreased. Please see full important safety information at the end of the video. Please see full prescribing information, including patient information.
Hello, I'm Dr. Edward Pearson, a hematologist at Texas Oncology in Dallas, Texas. Bruton's tyrosine kinase plays a key role in B-cell receptor signaling. CALQUENCE is a small molecule inhibitor of BTK which binds irreversibly to BTK, thereby inhibiting its activity. In non-clinical studies, CALQUENCE inhibited BTK-mediated activation of downstream signaling proteins CD86 and CD69 and inhibited malignant B-cell proliferation and survival. CALQUENCE is a selective, next-generation Bruton's tyrosine kinase inhibitor. Biochemical models were used to measure inhibition activity of ibrutinib and CALQUENCE. The kinome plot visually shows which kinases are inhibited, with larger circles representing stronger inhibition. Bruton's tyrosine kinase is shown in green and the off-target kinases are shown in red. The relationship between this data on enzyme inhibition and clinical outcome has not been established. For CALQUENCE, the only kinase with more than 99% inhibition at 1 micromolar concentration was BTK. The kinome plot visually illustrates the relationship between various tyrosine kinases. I find it a very compelling illustration of CALQUENCE's ability to target BTK with few off-target effects. In the era of targeted therapies, having an agent be as specific to its target as possible is very important to me. I'm certainly concerned with off-target activities. One of the most concerning things in medicine is not knowing what you don't know. To review, the key attributes of CALQUENCE from a mechanism of action perspective. CALQUENCE selectively targets Bruton's tyrosine kinase. CALQUENCE is a more potent inhibitor of Bruton's tyrosine kinase than of any other kinase, and CALQUENCE inhibits few off-target kinases such as TEC, EGFR, and ITK. Thanks for watching.
Important safety information about CALQUENCE, acalabrutinib tablets. Serious and opportunistic infections. Fatal and serious infections, including opportunistic infections, have occurred in patients with hematologic malignancies treated with CALQUENCE. Serious or grade 3 or higher infections, bacterial, viral, or fungal, occurred in 29% of 2,055 patients exposed to CALQUENCE in clinical trials, most often due to respiratory tract infections, 18% of all patients, including pneumonia in 14%. These infections predominantly occurred in the absence of grade 3 or 4 neutropenia, with neutropenic infection reported in 8% of all patients. Opportunistic infections in recipients of CALQUENCE have included, but are not limited to, hepatitis B virus reactivation, fungal pneumonia, pneumocystis jirovecii pneumonia, Epstein-Barr virus reactivation, cytomegalovirus, and progressive multifocal leukoencephalopathy, PML. Consider prophylaxis in patients who are at increased risk for opportunistic infections. Monitor patients for signs and symptoms of infection and treat promptly. Hemorrhage. Fatal and serious hemorrhagic events have occurred in patients treated with CALQUENCE. Major hemorrhage, serious or grade 3 or higher bleeding, or any central nervous system bleeding, occurred in 4.7% of patients, with fatal hemorrhage occurring in 0.1% of 2,055 patients exposed to CALQUENCE in clinical trials. Bleeding events of any grade, excluding bruising and petechia, occurred in 39% of patients. Use of antithrombotic agents concomitantly with CALQUENCE may further increase the risk of hemorrhage. In clinical trials, major hemorrhage occurred in 5% of patients taking CALQUENCE without antithrombotic agents and 3.2% of patients taking CALQUENCE with antithrombotic agents. Consider the risks and benefits of antithrombotic agents when co-administered with CALQUENCE. Monitor patients for signs of bleeding. Consider the benefit-risk of withholding CALQUENCE for 3 to 7 days pre- and post-surgery, depending upon the type of surgery and the risk of bleeding. Cytopenias. CALQUENCE can cause grade 3 or 4 cytopenias. Grade 3 or 4 cytopenias included absolute neutrophil count decreased, 28%, absolute lymphocyte count decreased, 10%, hemoglobin decreased, 9%, and platelets decreased, 9%, in 1,758 patients treated with CALQUENCE alone and in combination with obinutuzumab or venetoclax. Grade 4 neutropenia developed in 14% of patients. Monitor complete blood counts regularly during treatment. Interrupt treatment, reduce the dose, or discontinue treatment as warranted. Second primary malignancies. Second primary malignancies, including skin cancers and other solid tumors, occurred in 16% of 2,055 patients exposed to CALQUENCE in clinical trials. The most frequent second primary malignancy was non-melanoma skin cancer, reported in 9% of patients, followed by other solid tumors in 8%, including melanoma, lung cancer, gastrointestinal cancers, and genitourinary cancers, and hematologic malignancies, 1.1%. Fatal second primary malignancies occurred in 0.8% of patients. Monitor patients for the development of second cancers and advise protection from sun exposure. Cardiac arrhythmias. Fatal and serious cardiac arrhythmias have occurred in patients treated with CALQUENCE. Grade 3 or 4 atrial fibrillation or flutter was reported in 2.2% of 2,055 patients treated with CALQUENCE, with all grades of atrial fibrillation or flutter reported in 7% of all patients. Grade 3 or higher ventricular arrhythmia events were reported in 0.5% of patients, including fatal cases in 0.3% of all patients. The risk of arrhythmias may be increased in patients with cardiac risk factors, hypertension, previous arrhythmias, and acute infection. Monitor for symptoms of arrhythmia, for example, palpitations, dizziness, syncope, dyspnea, and manage as appropriate. Hepatotoxicity, including drug-induced liver injury. Hepatotoxicity, including severe, life-threatening, and potentially fatal cases of drug-induced liver injury, DILI, has occurred in patients treated with Bruton tyrosine kinase inhibitors, including CALQUENCE. Evaluate bilirubin and transaminases at baseline and throughout treatment with CALQUENCE. For patients who develop abnormal liver tests after CALQUENCE, monitor more frequently for liver test abnormalities and clinical signs and symptoms of hepatic toxicity. If DILI is suspected, withhold CALQUENCE. Upon confirmation of DILI, discontinue CALQUENCE. Adverse reactions. Chronic lymphocytic leukemia. The most common adverse reactions, greater than or equal to 30% of any grade in patients with CLL in the ELEVATE-TN and ASCEND studies exposed to CALQUENCE, N equals 511, were anemia, neutropenia, thrombocytopenia, headache, upper respiratory tract infection, and diarrhea. Treatment-emergent decreases, all grades of hemoglobin, platelets, and neutrophils were based on laboratory measurements and adverse reactions. In patients with previously untreated CLL in the ELEVATE-TN study exposed to CALQUENCE, N equals 357, fatal adverse reactions that occurred in the absence of disease progression and with onset within 30 days of the last study treatment were reported in 2% for each treatment arm, most often from infection. Serious adverse reactions were reported in 39%, 69 of 178, of patients in the CALQUENCE plus obinutuzumab arm, N equals 178, and 32%, 57 of 179, in the CALQUENCE monotherapy arm, N equals 179, most often due to events of pneumonia, 2.8% to 7%. Adverse reactions led to CALQUENCE dose reduction in 7% and 4% of patients in the CALQUENCE plus obinutuzumab arm and CALQUENCE monotherapy arm, respectively. Adverse reactions led to discontinuation in 11% and 10% of patients, respectively. Increases in creatinine to 1.5 to 3 times the upper limit of normal, ULN, occurred in 3.9% and 2.8% of patients in the CALQUENCE combination arm and monotherapy arm, respectively. In patients with relapsed refractory CLL in the ASCEND study exposed to CALQUENCE, N equals 154, serious adverse reactions occurred in 29% of patients. Serious adverse reactions in greater than 5% of patients who received CALQUENCE include lower respiratory tract infection, 6%. Fatal adverse reactions within 30 days of the last dose of CALQUENCE occurred in 2.6% of patients, including from second primary malignancies and infection. Adverse reactions led to CALQUENCE dose reduction in 3.9% of patients, dose interruptions in 34% of patients, most often due to respiratory tract infections, followed by neutropenia, and discontinuation in 10% of patients, most frequently due to second primary malignancies, followed by infection. Increases in creatinine to 1.5 to 3 times ULN occurred in 1.3% of patients who received CALQUENCE. Drug interactions. Strong CYP3A inhibitors. Avoid co-administration of CALQUENCE with a strong CYP3A inhibitor. If these inhibitors will be used short-term, interrupt CALQUENCE. After discontinuation of strong CYP3A inhibitor for at least 24 hours, resume previous dosage of CALQUENCE. Moderate CYP3A inhibitors. Reduce the dosage of CALQUENCE to 100 mg once daily when co-administered with a moderate CYP3A inhibitor. Strong CYP3A inducers. Avoid co-administration of CALQUENCE with a strong CYP3A inducer. If co-administration is unavoidable, increase the dosage of CALQUENCE to 200 mg approximately every 12 hours. Specific populations. Based on findings in animals, CALQUENCE may cause fetal harm and dystocia when administered to a pregnant woman. There are no available data in pregnant women to inform the drug-associated risk. Advise pregnant women of the potential risk to a fetus. Pregnancy testing is recommended for females of reproductive potential prior to initiating CALQUENCE therapy. Advise female patients of reproductive potential to use effective contraception during treatment with CALQUENCE and for 1 week following the last dose of CALQUENCE. It is not known if CALQUENCE is present in human milk. Advise lactating women not to breastfeed while taking CALQUENCE and for 2 weeks after the last dose. Avoid use of CALQUENCE in patients with severe hepatic impairment, Child-Pugh Class C. No dosage adjustment of CALQUENCE is recommended in patients with mild, Child-Pugh Class A, or moderate, Child-Pugh Class B, hepatic impairment. Please see full prescribing information, including patient information.